All right, good afternoon, rather, everyone. Thank you so much for coming. We're going to go ahead and get started. We are really excited about today's Adaptation Community Meeting. For those joining in person and online, that is where you should be. So for those of you who don't know me, my name is Kristen Dreiling. I'm the Capacity Building and Learning Lead for the Adaptation, Thought Leadership, and Assessment Project, which is the USAID-funded project that Chemonics has here. And as part of our work, we do monthly adaptation community meetings. We host them here, and it's really intended to be a forum to bring together practitioners of adaptation, development, and all things at the nexus thereof to discuss the issues and learn from each other and really build a community of practice. So we're excited that you all came out today to talk about the very important topic of the health climate nexus. And today's presentation is part of our health and climate series. So we are really excited to get underway. Before we do that, and before I hand it over to our moderator and distinguished panel, just a couple of quick housekeeping items. The first is if you haven't already signed up for either both event notices and updates on climatelinks.org, please do so. You guys had a sign-in sheet right outside, and we're happy to add your name to their mailing list so you get event notices and a number of the great resources that we put out through USAID and other work. And for those of you joining online, I would just ask that you please mute your mics so that we can make sure we don't get any feedback and interesting side conversation. So without further ado, I'm going to turn it over to Colin Quinn, who is a climate advisor with USAID Africa Bureau, and he's going to moderate today, and he'll introduce the panel. So thank you very much.
Great, thank you. Yeah, my name's Colin Quinn. I work for USAID in the Africa Bureau on climate change, and I focus some on climate change and how climate change impacts human health. So a quick story before I introduce the panel. About 5 years ago, I was working in Mozambique, and I was at a meeting with the government, and they were preparing to how they wanted to prepare for the COP21 in Paris for the UNFCCC. And there was one person who came up to me. His name was Eduardo Samogudo, and he worked for the National Institute of Health, and he said, "Where are all the health people?" Because he was the only person in the room then. And that was kind of a moment in my mind that was an aha moment. And I had another aha moment shortly thereafter. I was reading I think it was the fourth assessment from the eyepiece from the Intergovernmental Panel on Climate Change, and it came out in 2014. And in it, they analyzed how much, if we focused on adaptation, how much we could reduce the impacts in several sectors. And the sectors where you could reduce the impact most was focusing on health, which was a surprise to me. So I hadn't been working on health prior to that, but that certainly piqued my interest and was another aha moment. So over the last 4 or 5 years, I've been working in this field and have been lucky enough to interact with the folks on this panel who are, I would say, some of the luminaries in this field. I think this field is still somewhat small, but growing rapidly, and it's a really excited time to be involved. But before I introduce the panelists, a couple kind of housekeeping and logistical items. I really want this to be a conversation. I don't want this to be us just talking to you. So participating, for those of you in the room, we hope that there's questions, and same for those of you online. And those of you online, you'll have an opportunity to ask questions, and you can type them in the box, and they'll get asked in the room. The way we have this set up is each panelist has about 5 minutes to talk about some of their work in this space, and then I'm going to open it up to a moderated discussion, which I hope that you guys have questions again, so you don't have to listen to my questions. So with that, I will introduce the panel, and we're going to start at the end with Tegan. Tegan Blaine, she's the Senior Climate Advisor for the USAID Africa Bureau. She's been in that role for 10 years, and she's actually leaving and moving to National Geographic soon, so we're sad to see her go. But she's been a real champion within not only USAID, but in the donor community on climate and health. So thanks for being here, Tegan. Renee Salgado works for the President's Malaria Initiative for USAID. And Renee did some of the earliest work I saw on how climate impacts malaria and what we should be doing about it. So a real pioneer in this field. Fernanda Zermoglio is the Adaptation and Vulnerability Specialist for USAID's project called the Adaptation Thought Leadership and Assessment Project. Fernanda's been a leader in climate change adaptation for the last 15 plus years and has also moved the needle, particularly doing some groundbreaking work that has led to on-the-ground changes in climate and health in some countries in Africa and beyond, I believe. And Julie, I'm sorry if I always pronounce your name wrong, Julie Tretange.
Good, yeah.
All right. Yeah. Works with NOAA, and she's also the Climate Change and Human Health Working Group co-chair for the U.S. Global Change Research Program. And Julie is somebody who's also been working in this field maybe as long as any of us, and it's certainly
longer, but we won't go there.
Yeah, and it's certainly a leader in this field. So thank you all for being here, and looking forward to the conversation. And again, I hope there's lots of participation from the audience. So with that, I'm going to turn it over to Tegan. And Tegan, I was just kind of hoping you could summarize and talk about how you've your experience working in climate and health from a donor perspective over the last 5 to 7 years that you've been doing it.
Thank you, Colin. Just a warning in advance, I am going to have to leave in about half an hour, so I apologize to all of you when I walk out of the room, but such is life these days. So I thank you, Colin, for beginning with that story about your role in Mozambique and beginning to talk about the climate change and health agenda. Okay, I'm getting instructions to speak closer to the mic. Good for all of us. At the time, I was leading a team here in Washington on climate change issues, and one of the people that Colin reached out to was me to begin talking about these issues. He was not the only one that I had heard from. There were other missions where health teams were already beginning to see patterns of changes in malaria that were concerning to them. And I'm not talking about the countries like Ethiopia or Tanzania where there are very large elevation gains where it might be obvious that malaria is changing. One of the key countries that spoke to me about their concerns was Malawi, where the elevation change is about 700 meters and is not necessarily one of those countries that you think would be very concerned about the changes in malaria. It raised a lot of questions for me. It raised questions about what countries might be facing the most extreme changes in health issues and what that might mean for a donor's portfolio. It certainly raised questions about what country governments, ministries of health were going to have to do. And it raised very practical questions about what we do differently to prepare governments and individuals and donor organizations and other organizations to prepare for these kinds of issues. So over the last few years, USAID has pursued a few different angles. Colin and Fernanda have led quite a bit of work at the bilateral level, trying to understand what the most likely patterns, what are the patterns already taking place in terms of how disease is changing due to climate change and establishing what those patterns look like and thinking about how those patterns will change over time and beginning to work with governments on that. But then we also took a step back and said, as a donor organization that has, for example, a PMI program that functions in many, many, many different countries, what are the big issues that we are going to need to look out for in the next 5 or 10 years, much less down the line or something like that? And so again, we were able to partner with the Atlas Project through Fernanda and others on the team to really start asking questions about where the patterns of disease across the Africa region would shift, not just within a country, but across the continent, and what that might mean for issues like how we choose what our budget levels will be in a given country. Should we ask the person whose phone is ringing to mute their phone? It is audible to everybody in the room. It must be one of the online people. Thank you. Anyway, over the last few years, our partners through Atlas, including Fernanda, have, and for those of you who were at the health talk last month, Sadie Ryan was very instrumental in this work. We put together a perspective on how malaria is likely to shift across Africa in the next few years, much less the next couple of generations. And there were some really key messages that were beginning to emerge from that work about areas that malaria was going to significantly increase just in the next few years, and the number of people who could potentially be implicated in those changes. There were also some other key takeaways, including that there are areas in Africa where it's just going to be too hot for malaria, and the incidence of malaria, the risk of malaria, is actually projected to decrease. And although it doesn't give you the granularity of what's happening in an individual country, that kind of work will definitely need to be followed up with more extensive work in a given country to get to the granularity that actual health specialists might need to start planning in that country. From the donor's perspective, it allows us to look at large-scale patterns and think about where we need to start expanding our programs to work with governments to build capacity to develop the data that they will need to even begin responding. It also allows us to think about where we might need to scale up budgets at some point, or where we might have the opportunity to scale down budgets, and how we begin preparing for those shifts in our global approach to a disease like malaria. At the time, I had hoped we would be able to do similar analysis on other diseases, like waterborne diseases. And in all honesty, the science just isn't far enough along in our understanding of some of those diseases and their relationship to climate variables to do as extensive an analysis as this team was able to do on malaria. But the malaria analysis alone, I think, is an incredible first cut at looking at how these patterns of an important disease like malaria are shifting across the continent, and what that might mean for strategies and organizations like USAID as we think about our budgets, as we think about the investment that we're making in individual countries, as we think about the skill sets that we need to have, not just among our own staff, but to be building in our partnerships with ministries of health and other partners all over the continent. So perhaps I'll stop there and leave it to others to talk about their experience. But that, to me, just the insights that have already emerged from the malaria work, I think are going to be very critical to USAID's choices around our response, both in the short term and in the long term. And I hope to see this kind of work expanded into other health issues in the next few years.
Perfect. Thank you, Tegan. And I think that's a perfect segue for Renee to talk about some of the work that's been going on in malaria.
Please, Tegan beat me to the punch. I did sit down this morning and wrote some of my comments. I'm not going to read them, but I am going to refer to them quite extensively, so I don't forget important things that I want to tell you. But my first interaction with climate issues was 37 years ago in my hometown of Tijuana, Mexico, where the Santa Ana winds come each year. And if they come in April and May, they're hot, they're strong, and they burn the heck out of all the hills. Working in the slums of my hometown, the first thing that we would see is upticks in diarrheal disease and dehydration, and kids dying from diarrheal disease. We would then retrain our health workers, stock up, make sure that our referral systems were in place, and we could respond to the priorities of these very poor slums in and around the city. 30 years later, I know I look younger than but 30 years later, I ended up working in Africa on malaria with the President's Malaria Initiative. And an anecdote is that when I went to med school, in a part of Mexico where there was no malaria. It was desert, not even mosquitoes there. So my parasitology teacher said, you ain't ever going to see a case of malaria in your lifetime. I'll teach it anyway, but we have advanced since then, of course, and I am going to read a little bit of my experience with PMI, with my as a technical officer there. I was put in charge of the evaluation of impact of malaria interventions in 15 countries in sub-Saharan Africa. This had not been attempted before. Try to assess at the national level what was the impact of malaria control on malaria mortality and malaria morbidity. Really, really tough nut to crack. We decided to use something called a plausibility argument. To do that, we had to analyze as many contextual factors that could impact this mortality. And as such, we had to look at climate. And climate is the one who caused us the most trouble, because none of us in this team of people knew anything about climate. We didn't understand the language. We didn't understand how to use this data. We didn't even understand the data itself. So we brought climatologists into the equation, and guess what? We still didn't understand what we're talking about. And I guess that was one of the first lessons we learned, that we're not talking a common language, that the climatologists speak a certain language, public health people, epidemiologists speak another language. And trying to understand each other was one of the most difficult things to do. And in fact, that would be one of my recommendations going forward, that we do. When I saw the Mozambique report that you're referring to, I said, okay, finally, something that some of us can understand. Because before that, it was really, really difficult to do. To do this at national scale, to do this over 10 years, which was the range of the impact evaluation, was no easy thing to do. Because climate folks will say, they would come and tell us, well, Renee, they put a meter here, and 100 yards away, the same meter will register something else. How do we look at that data in a way that makes sense to those of us who are trying to use it with a very specific purpose? Triangulating that data at the national level over a long period of time was really, really difficult to do. However, we were able to do 10 of these evaluations. They are in the President's Malaria Initiative website. We published in the Journal of the American Society of Tropical Medicine and Hygiene. One of the articles in a supplement that we did is on climate data and how it's used to assess impact evaluations. And plus, we published several articles more. And one may think that, as simple as it is, malaria and climate go hand in hand, you would think. Well, it wasn't that easy. In fact, we're still battling people to try to get them to incorporate into their malaria control programs the issues of climate. I would say to my colleagues, if you present epidemiological data to me, I want to see the climate data too. I want to see it plotted against it. Otherwise, I cannot tell you if it means anything to me. I had the good fortune of living in Tanzania for 4 years. My wife, who's in the audience right now, and was dragged me there, working for the World Bank. And during that period of time, there was a drought in Tanzania. And guess what happened to malaria epidemiology? It dropped, right? And that was the first time I saw, for malaria purposes, that how important that climate data was and how it had to be introduced into malaria programming and into the analysis and triangulation of epidemiological data. We're still not doing it effectively at PMI. I do have other recommendations, the specific recommendations that maybe I will share in a few minutes when we start the big discussion.
Thank you, Renee. Yeah, Fernanda, I was hoping you could talk about some of the work you've done through the Adaptation Thought Leadership and Assessment Project over the last few years, particularly some of the on-the-ground success, and also, maybe not now, but if we have time, where you see it moving forward.
Yeah, thanks, Colin. I also prepared some written notes. But I'm actually going to talk to you about sort of the framework that we used in starting the work and some of the priorities that we identified in the health and climate space together with Tegan at the inception of the project, and what we've done to address that with a couple of examples. So when we initially started the project, we had a set of analytic questions we wanted to answer in the climate and health space. One was around hotspots. So where are areas going to be affected, or where is disease burden going to increase or decrease based on climate change? The second was, and it's sort of related to what Tegan was saying around waterborne illnesses, is that in spite of the fact that most countries identify the health sector as a high priority and very vulnerable to climate risks, and this was 10 years ago before the NAPs, the National Adaptation Programs, were developed, in spite of the fact that those countries, most of them think health is one of the priority sectors, almost no money, and I mean 1 to 4% of the national or the international adaptation funds have actually gone to the health sector. And the question was why? Was it because of a lack of an evidence base? In answering that question, we did a lot of risk analysis work. So not just on malaria, although we did focus quite a bit on malaria, but we looked at waterborne illnesses, diarrheal disease in Mozambique, and tried to just build that evidence based on the association between weather and climate and disease incidence, with the ultimate hope, of course, of developing early warning tools that could be used to pre-prepare resources, for example, for an outbreak. Diarrheal disease is very easy to cure, right? You need oral rehydration solutions. Well, what if we had a 6-week window to get those rehydration solutions to the right place? Would that help to solve some or reduce some of that curve that Julie will talk about, the curve of impact? I think that the last thing we wanted to do was to look for institutional and organizational models that would bring the ministries of health to the table in these discussions around health. So maybe the reason that there is little money invested in health in spite of the fact that the people are the human face to climate change, right, is because the ministries of health are not at the table when climate change issues are being discussed through the Framework Convention on Climate Change, et cetera. And so what we wanted to do was to look for ways of bringing that ministry support or that ministry to the table for discussion. And we found some really interesting opportunities, particularly in Mozambique, through the story of Eduardo Samagudo, where well-intentioned research entities that obviously lacked resources but had a lot of interest in tackling these issues would come to us and say, hey, the minister just called us and said, is this febrile outbreak in Southern Africa related to climate? Can you please answer that question? So kind of opening the door to having those discussions with the people that have the ear to the minister and being able to offer immediate responses to those questions has really been kind of catalytic, and catalytic for the country itself. I don't give Atlas all of the credit for what's happening in Mozambique, but I think we played a very big role in bringing the issue of climate and health kind of to the fore of the public. In fact, we had, when we published our work, the work was launched by the first ever sort of debate on climate and health in Mozambique, and it was opened by the Minister of Health together with the Minister of Environment, recognizing the need to work together across different sectors in order to really address the risks that climate will pose on health. So a lot of great opportunities. I think together with Renee, I would say that there's more opportunities opening up right now. The world really has changed. The community is growing. When we started this piece, it was very hard to find people to work with, and now I think we have a great cadre of people that we know ourselves that are working on the issue, but at the same time, WHO and World Bank and others are pushing the health agenda forward, and I think there's a great opportunity for actually making the health budget and these global adaptation strategies the largest budget moving forward. So thanks, Colin.
Perfect. Thank you so much, Fernanda. Another good segue to Julie. And Julie recently published a paper on early warning systems for climate and health, which I encourage you to read. And go ahead, Julie.
There we go. So before we get to that, I just wanted to say that I'm actually quite honored to be at the table with all of you. And we're not going to go down how long I've been at this, but a little bit of, I have two hats here, more than two hats, but two hats at this particular table right now. I started at NOAA, the National Oceanic and Atmospheric Administration, for those of you who don't know. We are a part of the Department of Commerce, and our mission is, among other things, to predict climate and changes in the Earth system. We're the prediction people. We've got the weather service. We do the seasonal predictions. We've got tons of data. We house data on the Earth system side of things, not just for the U.S., but globally. And we do a lot of research. We also have some enforcement with fisheries and that, but for this purpose, it's mostly the data, the research, and the prediction part. And so I was, after graduate school, young and naive, and I came to the Hill to do an internship for a year, and I thought, oh, great, well, I'll see what DC is like for a year. And that was in 95. Jeff, don't correct me if I'm wrong, because okay, there we go, the same school. And I came to work for NOAA in the climate program. I wasn't a climate change person. I'm a common property person. How do we manage shared resources and shared threats? Okay? What is the shared resource and what is the shared threat? And I was brought into NOAA with a few people when the El Nino forecasts were first publicly available, first time in 97, 98. Now you all know what El Nino is, but at the time nobody knew what that meant. Nobody knew what about rainfall and mudslides and all this stuff. And our job was to make the world safe for El Nino forecasts. And so I had, coastal zone and fisheries and health. The health was one of the many sectors. And to make a very long story short, at some point along the way during this process, my boss, we started this project to look at what that El Nino meant for health. And this was 97, and I had some really great health researchers, many of whom are now like leaders in the field, but they were just getting their PhDs at the time, and I thought, great, let's get everybody together at the table. I'm like, just out of school. Let me see what you need from the health side. Well, what do you need? And literally, I had the best climate, and really, like, amazing names, people that are all over papers now on the health and the climate side at the table. Okay, well, so climate guys, what do you need from the health folks? I don't know. What do you have? And health folks, well, okay, can I send you with a hobo? What's a hobo? Hobo is a way of data gathering. So nobody, back to your bilingual. My undergraduate degree, I had a foreign language degree. So I actually feel like I'm bilingual now in climate and health. And interestingly enough, we have bridged some of those gaps, but not all of them. And the fact that you are now generating really substantial knowledge on the health side, the donor side, the application side, because I sit with the people who want to crank out forecasts and spend billions of dollars flying satellites, doing in situ systems, and making forecasts. So for those of you in the room, at the end of this conversation, at the end of this, when I'm finished talking here, we can have a conversation about how you can help direct that kind of resource to be helpful to manage health risks to manage your donor money, to manage your budget decisions next year, 5 years, 10 years, 20 years down the road, because that money is going to be going to fly the satellites and make a forecast. And the more clear we are about how that forecast is useful for health, the more you can help direct those dollars indirectly. So on the donor side, from the earth science side, I just wanted to say that, and I'm not going to spend quite as much time on the slides because I used it all on that, but go ahead. So the slide that, so this whole notion here is how do we take all the observation capacity, whether it's an ocean observation, whether it's the in situ that's at an airport that's not in the right space. I have a whole Rift Valley fever story I could tell you. We've got to get the data to be temporally and spatially compatible. But also, I think it's really what do we need? I mean, some of the information that you've done, the analysis you've done, maybe we don't need as much a scale. Maybe we don't need to define a resolution model. Let's figure out what we actually need to do. But if we do it right together, we can use the observational and forecasting tools that we have and that we're already doing with some modification to really inform and change the area under the curve. So right now, if we don't do anything, it's business as usual. We're going to have a malaria outbreak. We're going to have an Ebola outbreak. We're going to have some kind of outbreak. But we know enough to be able to do something better than nothing, right? What is the risk of taking some action now? What action can we take with a little cost, with a little bit more cost? What is that balance of what you can do because you know that there's a risk of something coming versus the cost if you take it and it doesn't happen? The benefit of taking action and preventing something. That's the conversation. So the idea here is to use the environmental data in concert with all of you who are dealing with health issues on multiple timescales to make more valuable and useful decisions with that information. And then to feed back to us, because my job is to go back to those guys and get them to figure out how to do the right data collection and the production tools that you actually need. So I have two examples of what has worked. There are more. We've already heard some examples of malaria. One is a little bit more robust, and this is the Rift Valley fever notification. There is actually an official site for Rift Valley fever on the WHO site. And I point this out because this is a little data story too, and an interagency institutional story. So we know that El Nino affects rainfall, which affects Rift Valley fever. I'm not going to get into epidemiology at this point because it's not important. The point is we know there's a connection there, and there's a system in place for actually looking at the El Nino and what that means for the risk of Rift Valley fever. The interesting part here is this part at the bottom that has all the U.S. federal agencies on it. That was a huge deal to get, okay, there's an El Nino forecast coming, and the folks who do Rift Valley fever know that, okay, well, that means a greater risk here. We had not put it all together with information that says you might want to get out ahead and vaccinate the cows before the rains come and wash out the roads and you can't get there. You know, those kinds of tools, just putting even existing information together can be powerful. It doesn't even have to be a lot of research or a lot of money, just using what you've got. This was an experiment. It's not ongoing, but it could be. Okay, can you hit the next one? The next one is a much lower tech thing. This was the 97-98 El Nino, and I've dragged this out of my slides. It's probably grainy because of it, but I thought it was important. This is in the high island of Ponape in Micronesia, and we went out and did a huge campaign during the El Nino. Say, it's raining cats and dogs. You can't hear me over the tin roof, but there's going to be a drought in 6 months. Plan ahead. And they trusted the forecasters enough because they'd been working together long enough to trust them and said, all right, wow, it's raining cats and dogs, but we're going to do it. They set up an El Nino task force, and the long story short is they had a reduction in diarrheal disease. Reduction, more than a normal outreach, because this was like a song that was requested on the radio. It was a campaign in the local language. There was no model. It was a forecaster who had a community that trusted him, and they went and did it. Little risky, because if we were wrong, it could have blown up. But it doesn't have to be some big, robust model. It can just be what you need, okay? And then the last slide, please. So the, one more. Yeah. So the other piece is that we do this for other things. We do this for drought. We have a really robust system for famine early warning. Why do we not do this for health? Why can we not get our institutions more closely aligned in a sustainable way with the right money, with the right people, and the right time to get the right information so that you can make more informed decisions? There's no reason we can't do it. Why are we still surprised by Ebola or other things that are happening, or why are we not doing a better job of managing the ones we know? So I'm just going to leave with that as a challenge for us, both scientifically and institutionally, and I'll stop with that.
Perfect. Thank you, Julie. So, yeah, we can give the panel a round of applause. So Tegan, I know you have to leave in 3 minutes, so I'm going to ask you a quick question while I have the opportunity to have the floor. You said something. You said the science isn't quite there for lots of potentially climate-sensitive health issues. So, moving forward, where do we focus, particularly, and what's the donor? What is our role as a donor agency?
Very good question, Colin. I would probably highlight two things. One is that there is a lot of capacity building that can happen that doesn't require extensive knowledge of how diseases work. Countries can begin building surveillance systems, for example, together with climate systems and integrating those kinds of systems so that the early warning of changes in disease patterns those kinds of changes in disease patterns are detected early and that a response is planned along the lines of the slide that Julie showed, where if you can show that if you can detect changes early, you have more time to respond and can limit the number of deaths or other impacts of that disease. And that's something that you can do without understanding the linkages between climate and how those disease patterns emerge. But I also think that there's quite a bit of science that will be developed more slowly, but we should still be investing in better understanding the linkages between climate variables and disease outcomes. One of the first things that we did in the Atlas project when we began investigating this was to try to just write down some of the key diseases in the Africa region and what was known from science, kind of went through the scientific literature to say, what are the linkages to climate variables? And it was amazing the number of diseases where we still have exceedingly limited information about how certain diseases respond to increases in temperature. We know that there is a relationship. We don't understand the why of that relationship even now. And so there's a lot that can already be done even without understanding those relationships, but there's also worth in investigating those relationships from a scientific standpoint and understanding the whys so that down the road we can do a better job of understanding how the large-scale patterns are going to change over time. And I apologize that I'm going to have to leave. I look forward to listening to the rest of this online. Have a good conversation.
Yeah. Thank you, Tegan, so much for being here. So Renee, Fernanda, Julie, before I open it up to audience questions, do you want to respond to anything Tegan just mentioned or add to? And it's okay if the answer is no.
One of the things that Tegan mentioned is that we don't need perfect knowledge in order to act, and I think I echo that that view. We know enough in order to reduce the vulnerability of a lot of people to climate risks. But there are also some really cool new tools that emerge from the Earth Observations Network, but that can kind of facilitate that understanding, that mapping of your risk or your incidence with weather patterns, such as Google Earth technologies that are already being used and leveraged to provide early warning on malaria, for example, in the Amhara region in Ethiopia. And I think the world has opened up in the last couple of years. We're no longer dependent on having a server Ministry of Health that we have to pay for, and then there's no power, and then nobody can run the server, and we're no longer dependent on those things. There are also countries are beginning to open up. There are information revolutions taking place, not across all countries, but there are countries that are beginning to say there's not as much value in the data as there is in the knowledge and the translation of that data. So let's share it across institutions. And so there are a lot of opportunities that I think, and maybe it's just optimistic, and maybe it's just like, oh, this project is ending, and how do we make this sustainable in the future? But I think that the world is becoming very ready to receive this, and the tools are in place to do that. The question is, how do we prepare the people to make that happen? So, exciting times.
No argument with that. I would say, how do we prepare the people and the institutions? Because I think there are two reasons. I would second Tegan's comment that we still need probably to understand the mechanisms better of how these diseases are transmitted, but I don't think we need to wait until then to take some actions. I think we're beyond that even on the panel. So research is necessary, but it's not the stopgap. I do think that there is an institutional shift, a paradigm shift, and I think one of the things that we've done, I co-chair a U.S. Global Change Research Program, has a climate change and human health working group. It's USGCRP is established by a law, the Global Change Act in 1990, and it has 13 federal agencies that have worked together to tackle climate change issues for many years. Usually traditional long-term, climate change stuff, but 10 years ago they created this health group, and I lead it with NIH and CDC. And one of the things we did was reach out to some of the other parts of the U.S. Global Change Research Program and community and a different group of the Pandemic Prediction Forecasting Science and Technology group led by a different part of the White House to tackle how do we do I know, lots of acronyms. The point is the federal folks are trying to work this out because there's a real recognition that we don't have the institutional connections, sustained institutional connections, the legitimacy to act, the authority to act. The science is actually the least challenging part of all of that. To be able to say, yeah, we can say something about Rift Valley fever or malaria and get it to the right people, whether inside the intelligence community, outside the intelligence community, donor community, missions abroad. We don't have the institutional structure that really facilitates that kind of trust and that kind of communication. I think that's a really huge challenge. And you guys in the room, and I was quite genuine, I'm really honored to be here because I think these are the conversations. You guys are the people that can help make those institutional changes, whether it's top down, bottom up, it's got to be both. So I feel like the science, yes, definitely. I don't want to undercut that. We fund research and we need research capacity that has to be joint with health folks, climate health. But I think the institutional part is really maybe the up and coming biggest challenge we might have. Oh, and I should mention that the whole point of that interagency group is we just did a report on how to manage the prediction of emerging and climate-sensitive infectious diseases, and that's posted on I'll get the website in just a second. I don't remember offhand. Do you? we just posted it like 3 days ago, so we should definitely send you a link to that report because it begins to outline some of that and gives the agencies some ability to work together. It's not the end all, but it's a start. So, yeah.
Yeah, go ahead, Renee.
I guess what I was thinking to point out something that you were also referring to. Policy making in this environment is really messy. It's not, you have the evidence, therefore we go there. It's not quite like that at all. With funding streams coming the way they're coming, balkanized, separate, not integrated, obeying to political agendas, all of this stuff, what we need to figure out is how do we work in that crazy, complex, political, human behavior environment, and there's no answer to that. I've been struggling with this within PMI for 11 years, something that should be fairly straightforward. Malaria, climate, they're linked. I would get on a project that gets about $700 million a year, I would get, if I was lucky, $100,000 each year. And not because these folks are not smart, they're very smart, the ones who hold the purse strings, but they are also not controlled, but limited by other interests and other, for example, just one example, on emergency response to a malaria epidemic, or what you may think a malaria epidemic may occur. Well, here's the thing. Some of our commodities have a 2-year expiration date. We can't deploy certain commodities like rapid diagnostic test and have it someplace to the detriment of another place. So it is this crazy part of the equation that we are not dealing with very effectively, I think.
So with that, I would love to open it up to questions in the room and online. So yeah, feel free. If you have a question, please raise your hand and a mic will be brought to you. And can I ask, if you're asking a question, could you please just briefly introduce yourself before you ask the question? Thank you.
Thank you. My name is Neil Boyer, and I'm the environmental specialist with Peace Corps. And I want to go to the issue of water because, we look at, 30 or 40 coastal countries where we have volunteers deployed from Madagascar, Mozambique, etc. We know that climate change is going to cause an increase in the frequency and intensity. Hurricanes, cyclones, typhoons. We know, like in the case of Mozambique, you have these cyclones hit. People don't have access to water. You're going to see an increase in diarrheal diseases or cholera, etc. What is the link between, if we know that we're going to have increasing frequency of storms, how do we prepare our countries to say, do we have different kind of storm-proof water systems? Do we put them high up on so that they're not swept away, so that people who are getting their water from wells and those wells are polluted with all these floods, what's our strategy? I mean, I put together a list that we send to our posts from the Philippines and whatever, and we see that since 2000, we have a number of countries that have at least 5 years or more of super cyclones, etc. How do we respond in the context of waterborne diseases?
Fernanda, you want to take the first stab at that?
I was actually thinking about this because I lived in Mozambique, and in the aftermath of the latest cyclones, you're seeing an uptake of waterborne illnesses. But interestingly enough, if I can just sort of come full circle to your question, what you're also seeing is that the cyclones hit right at the peak of the malaria season. So in addition to not being able to deliver, one, you have a lapse in surveillance, right? Two, you have a change in priorities, and all of the funding that was available for malaria is now being diverted into the cyclone response, which means that both drug supplies are being broken, right? Three, you have people isolated and unable to get to their resources. The way that health system strengthening works is you look for service delivery, an educated workforce, a governance mechanism that would allow modifications to be made, and you try to bring those things together. Now, this is not rocket science. This is what health systems do regularly, and oftentimes in climate change, we're looking for like the new and shiny and innovative thing instead of just the improvement, the slight improvement that needs to be made in order to guarantee or safeguard your investments or guarantee a slight improvement in your results. So it's not necessarily answering your question directly, but I think having people, first, awareness is really important too. Training of health professionals is important, but it's a whole cadre of things that needs to be done. Service delivery, the actual availability of drugs, all of those things need to come together in order to kind of guarantee outcomes. But being aware that the problem might exist is also part of the solution.
So I would actually kind of toss it back to you. You are the right person to be asking that question. And so one of the things I would like to ask those of you in the room and maybe on the phone is, what is the mechanism to get the right organizations in your country? I mean, is it different? It's not just ministries of health, it's ministries of transportation and finance and the environment, wherever you're, sanitation, right? Is there a way to like run a scenario exercise, not a 100-year scenario, but like a decision scenario exercise? We've done this for heat. I manage a whole program on heat, and actually I ran an oceans and health program, so I'm the water person in my own agency, Water and Health, so that's right up my alley. But we have done things with, like in the U.S., we've got the sea level rise viewer, and we can show sea level coming up in coastal environments. We may not have that capacity everywhere, but we have it for some places. So I'm wondering if we could begin to think about, bringing your hydromet, your sea level rise people, along with your health and your transportation and whatever is the right ministries in your country together on a regular basis to say, okay, we know this is coming. We've seen X number in the last 3 years. How do we plan? Because I think from what I've learned so far, it's a national level planning exercise, but the impact is at a local scale, and I don't know, each country is going to handle that differently. So I would ask you all, what are the mechanisms to do that?
I'll just jump in. Okay, so I'm Jeffrey Blade. I work a lot with Colin in USAID in the Climate Change Office. And I've really appreciated the comments and also the question. So you guys do international work, and there was, I hate to even mention this, but there was, under the Obama administration, an executive order, which actually still stands, that all the development work that we do, and USAID is the primary development institution, but Peace Corps is doing this too, should be robust to climate change. We should do resilient work. And so under that, USAID actually has a policy called climate risk management, which makes it a requirement for all the programming that we do, with few exceptions, like for disaster relief, humanitarian assistance, things like that, where we actually have to screen and assess potential climate risks and how they might affect the programs that we're implementing and the objectives that we're trying to achieve. Now, this is still, as Colin and, well, if Hagan was still here, she would attest, this is still a work in progress. There's a cultural change that needs to happen because people just want to get their programs out. But there's a cadre of us that are working across the agency to provide, like what Julie, you were talking about before, like trying to get people together, right? So having someone who could actually understand what climate information you ought to get and how to interpret it into the hands of the people who understand the technical details, right? So that's something that's happening. And Colin, I don't know if you want to add to that, but I just wanted to respond because we could share more about this with the Peace Corps. I know some global health programs actually do a direct transfer of funding to the Peace Corps for certain work. And then it's really up to you guys, just like when we transfer funds to the Navy or Army or whatever, CDC, like through those interagency agreements, the agencies who receive the funding actually have the responsibility to make sure the programming is effective through climate risk management. And all the things that Fernanda and Julie just said are actually what you would do. It's not something shiny new, like new, tool. It's just thinking through like what could be the risks and how you can prepare for those. So I actually had a question also, but did you want to comment?
No, we'll go you, and then this person's been waiting patiently, and then maybe we'll see who's online.
I'm Rose Schneider, and I had the pleasure of having 3 of the 4, or I guess 3 out of the 5 panelists speak at the American Public Health Association. And I'm chair of the International Health Working Group within the International Health section. And the question of institution building and interest building has just made me really try to think through how we get people who are doing their everyday jobs to be interested. We've tried numerous things, we really have, but it sounds like at the larger institutional level it's working, it's moving. but it is I like any new ideas on how to get even the leadership of a section to say that they're interested in at least exploring this, because I get essentially it's a hard thing. Thank you.
Yeah. I think it's for anybody. But I think you faced some similar challenges, Renee, and
I would say also that, in fact, it's sometimes, in the case of the President's Malaria Initiative, grappling with climate from the top came down to a personal conversation between the Minister of Health of Ethiopia and our coordinator. We have done all these plans of strategizing, Colin and others, how do we communicate to leadership what they need to know, the science, this and that, and we had brown bags and this and that. In the end, it came down to one conversation that the Minister of Health of Ethiopia had with our coordinator, and he asked, can you help me with, we're trying to eliminate or eradicate malaria from Ethiopia, but we do understand that climate is an issue. Can you help us? That has unleashed resources, interest, all kinds of activity. So that's the long-winded answer. The shorter answer is we need to get at it from both sides, from the grassroots level, training our own personnel within, in our case, a lot of very young professionals who don't have as much experience. Their comfort level is small. They don't want to get out there, jeopardize their careers for something that may not there be payback for them, and also all the way to the ministers of health who have a vested interest in this and say, can you help me? And after 11 years trying to do this, within the organization, it came down to an important political person asking another important political person for help. And so we may want to retrench and rethink that some of it must come from the countries, must come from these appointed officers of government to demand and request that that attention be paid. But they will not answer. They will not ask if often I'm going to speak ill a little bit about USAID in the sense that we believe that because we forget that because we have the resources, people listen to us. And that we are right. Not really true, is it? So we need to also convey to our officers in the field and with government that in fact they are also right. They can be right. They can tell us this is what we want. This is what would make sense to us. Help me with that. But you need to create the space for that. It doesn't exist naturally because we come with a check for $100 million.
Can I just stand up and applaud right now, loudly? Thank you. Completely agree with that. And I will just add one other piece, that it isn't just getting your health ministries involved, because I'm from NOAA. We don't do health. I cannot tell you how many times a day, even after 20 some odd years, I still get, why are you working on health? Well, we do energy, we do drought, we do water. Why not health? What, should CDC go build their own observing system because we don't do health? So you guys in the driver's seat, you're absolutely right. We need the demand from the health side that says, we want to work with you. We're trying to understand these questions, and we'd like for you to come along with us, because otherwise you'll never get your Ministry of Health, your National Hydromet Service to come to the table. They're not allowed. It's very top-down. Even our weather service is a part of NOAA. our weather, we have 122 forecast offices around the country in the United States, and they won't talk to health people unless there's a command. I mean, that's a very command and control hierarchical, because their job is to produce the forecast. I mean, they've got a 24/7 job. So to go out and talk to a health person, like, they don't have time for that. So we have to make the demand for the institutional connections. And really, that does need to come from you guys on the donor and the health side. I just want to make a plea for that.
So lots of questions. Okay.
So I work for Mark Labs, and we're a data analytics company here in DC, and we help, I guess right now, mostly investors and corporations mitigate ESG risks, environmental, social governance risks, and we help impact investors measure the impact of their programs. And since we're primarily working in the corporate world at the moment, I guess one question that I had was, how are you, is anyone conducting any sort of materiality analysis on, the financial impacts of climate change and health risks for the government? Because from what I see, a lot of the corporations these days, they are identifying the environmental, social risk factors that are financial material to their bottom line. And let's say if you're a food and beverage company, Jamaicans are located in Jamaica, and you are Red Stripe, for example, and we have a water problem in Jamaica. So Red Stripe has incorporated their CSR efforts around water problems and trying to galvanize the government and private sector around their biggest issue is, if you don't have water, you don't have beer. So I guess that's my question. How, are we putting these things in economic terms so that they can see, okay, what the writing is on the wall as far as their bottom line? Oh, sorry.
So the economic studies that have been done have been sort of global, and they're trying to make the case for kind of high-level decision makers. So, for example, malaria, diarrheal disease, and malnutrition estimates are that we'll need something like 8 to 12 billion additional dollars a year to address these risks in Africa. But that doesn't really get to what you need to do differently. I mean, it's and where we have spent the majority of our time is, what do we do in response to that risk? How, at the granular scale, what do you need to do in order to respond? So I mean, there are a lot of challenges, I think, that remain, particularly around supply chain management, especially in this sort of just-in-time logistics world. How do you manage or mitigate the risks from just extreme events, let alone like long-term impacts? And there's a lot of work to be done, and there are few companies in the world that are actually beginning to look at those issues, like Coca-Cola, like Unilever, and others. But it's not across the board, unless that is sort of it's a requirement of the financial mechanism that they're using to do their work. Like, for example, the Highway 2000 in Jamaica, they have Freeboard, looking at potential that will mitigate the sea level rise way beyond anything that the Ministry of Transport might use. But that's because their insurance company says, we won't insure it unless you have this Freeboard, which is their own sort of way of mitigating the risks. So.
Yeah, I guess where I was going with that question was, if you're looking at the government, is the government and the departments that you're working with, are they looking at the financial impact of a climate risk?
So to answer that question a little bit more head-on, although this is useful, interestingly enough, I was brought to NOAA because I'd worked in the private sector on Wall Street for a while to do venture capital and work with pharmaceutical companies for supply chain. Turns out that's kind of illegal because you're in the Commerce Department and you can't actually talk to a company directly. It's unfair advantage. So I was unable to actually do that for very long. But we are in the Department of Commerce, so our chief economist is actually interested in these questions, but the short answer is no. We're not doing it well enough, and it's actually really hard with health. It's been my experience. I've run research programs specifically asking for economic studies, cost benefit, value of information kinds of things, and the proposals are just not coming in. I mean, the science, it's not a traditional health economist, it's not traditional cost benefit. I don't know what it is, I'm not an economist, but we don't do a very good job on a regular systematic way of saying how much it's going to cost, what we think it's going to cost, what it's already costing, and what's the benefit of early action so you can make some more informed decisions. I think that's one of the biggest science gaps, honestly. So I wish I had a better answer, but the reality is I don't think we're doing it that well, as far as I know.
And I'll just really quickly add to that. I agree we're not doing it that well. But Jeff was talking about climate risk management. So when you're managing climate risk, you're essentially preventing things from happening based on climate variables. It's really hard to quantify that and say this is how much money. Let's say it's a health supply chain project in Mozambique that wasn't in the path of a recent cyclone. It's really hard to say you saved this much money by doing that climate risk management. But I agree with Julie. I would like to get to that point, but I don't know how. Next. Oh, yeah. Go ahead, Renee.
Maybe
and then we'll go over here.
Words. And I think that what you're saying is terribly important. For malaria as a disease, not the climate part of it, as a disease, began in fact with the Macroeconomics Commission on Health back in 1992. Who was there? Who was alive? And it assessed the economic impact of malaria on countries, on communities, on individuals, and whatnot. Ever since, there is revisions of that. But we are, I think, in my perspective, and I agree with you, that we need to step back, maybe reassess some of that, and bring it to a more modern era where the threats, climate change, and whatnot, bring that part of the equation. As imperfect as it was back then, whatever we produce will be imperfect. But the lack of perfection should not stop us from just saying, you know what, we'll catch the flack. They will throw it at us. That's fine. When we started doing the impact evaluations, they told us that you're insane. You cannot do national level evaluation of a disease of this nature. It's just not possible. Well, we did it anyway, and it's very imperfect, but it unleashed science beyond what we were doing. And others are publishing based on what we did, and they took it to the next level. So what I'm saying is it may be time to reassess some of this and take stock on the economic impact and benefits of climate change for some of the diseases.
Yeah, the gentleman back there.
Yes, hello. I just wanted to ask a question in relation to, Julie, your reference to the FuseNet. For me, that definitely struck a chord. I have long wondered, especially in relation to water, why we do not have an early warning system for water health and the impacts of human health. In that regard, I definitely agree that science is not the barrier. It is the institutional relationships and the relationship with private sector utility companies as well as country to country. And I'm particularly thinking of, for instance, our own very robust and comprehensive water database run by the EPA, the Water Base. And it just seems far-fetched that with this robust data, we cannot create a system or an early warning system akin to the FuseNet. So my question is, how are these conversations going right now between institutions? But more importantly, how is the private sector involved? And again, I'm thinking of water utility companies like Nestle that had non-disclosure agreements with municipalities and are not sharing their data. How are we addressing these boundaries, and what's the future for this conversation?
So, yeah, I have a few hours. No,
good luck, Julie.
Really good questions, and I'll try to be succinct in the answer. So I obviously think that we can do it. The institutional construct around water in the United States, this is not globally, I'm just speaking in the U.S. at the moment, it's really complex and really convoluted and complicated. So like you just spend a life doing water stuff in the U.S. But I will say EPA's water database, we have a water center that's based now in Tuscaloosa, Alabama, that's integrating, still trying to figure it out, but integrating the water models, building a water model for the U.S. So and they have health in their mandate, but they don't actually know what that means yet to how you actually make that relevant for health. So I think there's some potential there for the U.S. Those aren't the only pieces, but I think that the institutional barriers on water and health are huge, and people just get lost in how are we going to manage the tide gauge system, and how are we going to build this coupled model for stream flow in the Mississippi, and how are we going to manage the water wars in the West, and all of those are very legitimate things, but to put all that aside and come up with a plan to manage water and health risks in the U.S. is just, we haven't clarified that as an important enough goal yet, I think, to make it happen, but it could happen. It is possible. We have the science, we have the data. We just haven't made it enough of a priority yet. So I think that is possible. I'd say globally, though, there's this thing called the Group on Earth Observations. It's a global system, a global construct, kind of a UN body, but not officially a UN body, that's about data sharing on Earth observations data. And there's a health focus in that. And within that construct, there's been several attempts to build early warning systems, one specifically on cholera. I know based on some of the research that you guys have supported, that other agencies have supported, there's now a system being sort of implemented with the United Kingdom and UNICEF to do a cholera early warning system in some country. I'm not sure I'm going to speak because I'm not sure which one, in Africa. So there are examples of where that could happen, and I think it comes back to your points about how do we make those institutional linkages, because I think the data are more and more available on the Earth system side. I don't know about the public health data side, but the water and sanitation I think is more doable. So we can do it. It just needs to be clarified as a priority for countries, including our own, and then the people and the institutions set in motion to make it happen. But I think it's doable, and it isn't a science issue so much. Yeah. Sorry, that's not a short answer.
No, thank you, Julie.
Hi, my name is Nanette Barkey, and I just want to say on a personal level, as someone who worked in Mozambique, I've never heard Mozambique mentioned in my life as many times as it has been today, so that's great. And also thanks for mentioning FuseNet, and also I wanted to just bring up the Coastal Cities Project because I know they've both been very active in Mozambique as well. And I have a comment and a question. My comment is the discussion of getting all the U.S. agencies to work together, to even talk together and be able to speak together is really helpful for me as a professor teaching public health to students who say, well, why can't the Ministry of Health talk to the Ministry of Finance, talk to the Ministry of this, talk to the Ministry of that? Well, if we can't do it here, this is a great case study example. My question is about dengue fever, and I was just curious if we've heard a lot today about malaria, but I was just curious whether dengue fever is something that is obviously spreading with climate change, and whether we're going to see more dedicated funding for that, whether we're going to see a president's dengue fever initiative. I don't know. Any sort of comments that the people on the panel have, I would be happy to hear about them.
So Aedes mosquitoes are a part of some of the research that we're funding to make operational products for cross-border risk, right? So small pockets of research dollars, I think, are making themselves available, but it's not a huge amount of money. I think it's not nearly enough. It's not orders of magnitude for NOAA versus USAID are like, yeah, and then you add the World Bank on top. We're just totally different levels, orders of magnitude here. So I think it is technically possible. And I guess the other part I was going to say is your point about the FuseNet and the water piece. I think if we were to articulate a few places where we would want to work, I think nothing succeeds like success, and a few places where we can do something, just start and do it and make it happen, it will, as you've experienced with malaria, get a life of its own. So.
I will just say that some of the empirical work that we did on shifting burdens of malaria were actually based on temperature kind of thresholds identified in the laboratory. And there are definitely those temperature thresholds of sort of survival, fecundity, biting rates available for dengue. The problem, of course, is that dengue is often misdiagnosed as malaria or malaria as dengue. And so the data on incidence is a little bit difficult to make the incidence data is not clear, and so it's difficult to make the case to look at dengue specifically simply because it's often misdiagnosed. But we did do some initial work on this topic within Atlas that has never been published. We just looked at Zikundengue, so all of the Aedes diseases and how they might be affected by climate risks. Since we did that work, though, we've found more empirical analyses, laboratory data, that is showing sort of the infected Aedes, infected with dengue species, and how they have a slightly even more tight threshold. So being able to map that into the future, I think, would be interesting. But just making the case is already a challenge because it's so often misdiagnosed in Africa.
And I'll add one thing, is dengue spreading? I mean, in places like Africa and Asia, which are rapidly urbanizing, dengue is more of an urban disease than malaria. And I think we are seeing it spread. But no, I don't know about a president's dengue initiative.
Talk to Singapore about that. They've got a great system, but it's a little detained.
Yeah, in fact, there isn't one, right? But outside of the President's Malaria Initiative, in the Latin American region, there was a confluence of resources for Zika, dengue, and malaria for entomological work.
Any other questions? Yeah, of course.
I would also just encourage folks online, too, if you have a question, to please type it in as we're getting towards the end of our time here. We want to hear from you as well. Thank you.
So first of all, thank the panel for their interventions. They were very interesting. My name is Laura Salamero. I'm an adjunct professor of law in Spain. I'm here doing research in Georgetown. So I'm adding a new language to the table, right? You talk about climate, health. So how much do you speak the legal language is my question, right? So what do you think is the role of the laws and regulations in your work? Do you perceive as the legal system that affects you as hindering your job or helping it? And how do you think these laws and regulations should be in order to be able to, face the challenges that climate change is posing on public health? Because you're talking a lot about Africa, but it's happening too in Europe and in the States, right? So what do you think from your perspective that us lawyers should be working, should be researching, should be looking at in order to provide better regulations?
That is a great question. I've never heard that question. Thank you. Anyone want to dive in?
Well, as far as climate, I cannot answer that. But as far as malaria control, there were a number of regulations that were in, again, Africa. They were problematic for introducing some of the materials, whether they're treatments, the tests. In Tanzania, I personally was reported in the local press as smuggling illegal malaria diagnostic tests that were not approved by the local regulatory agency. To be very frank, yes, I was guilty. But sometimes they don't move at the pace that you want to move. And the problem then is, well, the problem is that the window of opportunity is now. I have the money now. Tomorrow I may not have it. can we figure out a way to accelerate that process? And in that, how do we build the dossier to submit that to the local authorities, or how do we work with global authorities to impinge on the local authorities to, hey, speed up your process. We already have proof that this works, but when they did when I was mentioned in the press, and UNICEF also got dragged into it, all of these tests and everything had been thoroughly documented. It was not an issue. It was just we didn't have the stamp. So accelerating the process somehow would be useful, but I also understand that it is a prerogative of a government to do what they need to do in their own country.
So thank you for the question and for being here. That was courageous of you to walk into a room here as a lawyer. And one of my favorite classes in graduate school was public international law. I felt like if I'd known what that was at the time, I probably would have gone down that path. So I appreciate it. I would actually answer in two ways. One is a U.S. answer, so I apologize to those of you on the phone who it may not be relevant. But one of the most effective laws we have on the books that allows us to work in this space is the U.S. Global Change Research Act. And it establishes those 13 agencies. It stands still. I'll just leave that. And it is how we function to allow the agencies to work together. It's where the health, because it falls between all of the agencies' missions and mandates. It's how we work with Colin on a regular basis. It's probably how I ended up here because we have a structure. So laws that force and allow and create that space for agencies to work together, I can't speak to whether that's going to be useful in other countries, but it's definitely useful here. And I know there's different climate and health bills around, but they're like in the Health and Human Services. Our authorizing committees are different. So Health and Human Services might get a bunch of money to do this, but no, they're not going to know anything about it. And where are they going to go for their climate pieces? So getting the institutional and the policies aligned on that side of the equation so that we are forced and allowed to work together, I think is actually really helpful, at least to provide useful information to reduce the health risks in the United States from climate and weather-related things. And I just stop there. And then internationally, I think there's, my question would actually kind of be back to you from, there are committees of the United Nations and UNICEF that I think have other avenues, so the public international law is a whole different question and maybe something that sort of codifies it as a priority, but there are lots of moving parts internationally, so I can't really speak to that part. Yeah.
Okay, well, first of all, I want to thank you, the audience, for giving us your Thursday afternoon, and I also want to thank the panelists who I thought contributed to a really provocative discussion, so thank you, everybody. And lastly, I would encourage you to think about this conversation and think about how you can take some of this information back to where you work and what you do. And with that, I hope everyone has a good Thursday evening. Thank you.